Good afternoon, everyone. Good afternoon. I'm Zach Schamberg, and I'm the President and CEO of PHCA, or the Pennsylvania Healthcare Association. And behind me today is the reason that I'm so proud to advocate each and every day on behalf of long-term care in Pennsylvania. Behind me are the women and men who have remained on the front lines of the COVID-19 pandemic since March 2020. Behind me are the women and men who have cared for our most vulnerable population, my grandfather included, in the face of challenge, adversity, and hardship. Behind me are the healthcare heroes of Pennsylvania, and I think we owe them a round of applause. But I also think we owe them and the residents they care for something else too. You know, in years past, when we held a rally here in the Capitol, we were surrounded by hundreds of frontline caregivers who made it their mission to care for our aging population, our grandparents, our parents, our aunts, our uncles, and our neighbors. But today is different. We don't have the luxury of bringing hundreds of frontline staff to the Capitol anymore. And that's because the past 2 years have amplified every single issue facing our sector. Our workforce shortage has now become a crisis. Our operating environment is more volatile than ever. And our very operations, our very ability to provide essential care is in jeopardy today. A few weeks ago, we held another event like this down in Bucks County in Warrington. But we were there to announce the closure of a nursing home that specializes in ventilator care. So think about that for a moment. In one of the oldest states, in terms of our population in the entire country, we should be opening new avenues for care, not closing our doors and turning away our most vulnerable. That can't continue. And the healthcare heroes behind me today are here to ensure that it won't continue anymore. So we've got a very important question for the people of Pennsylvania. And we've got a very important question, and a simple question, for our elected leaders here in the state capitol. Who will care? If nursing homes, personal care homes, and assisted living communities continue to lose workers, who will care for our aging population? If providers are forced to turn away our loved ones, who will care enough to help us build back our workforce? And if more nursing homes close, who in Harrisburg will care enough to step up and do something about it? We need to be ready to keep our promise to care for Pennsylvania's most vulnerable. In a recent independent analysis of our long-term care continuum, it was estimated that more than 1 million people in this state will need long-term care in the next 20 to 30 years. How can we possibly expect to keep that promise today? The answer is sustainability. The answer is investment. The answer in the 2022 state budget is Medicaid funding. It's $294.3 million, or just $35 per resident per day. At PHCA, we have prided ourselves on coming to the table, especially throughout the past 2 years, with solutions. And this morning, our advocates behind me met with their legislators. They talked about the need for investment, they talked about the need for support, and they asked, who will care? They told their story. And even though we don't have hundreds of people here today, I am confident that our advocates made sure that their voices were heard. Now, I want to turn the microphone over to a few folks who also know how to make their voices heard. And first, I am very proud to be introduced by two of our legislative champions. And I want to introduce House Appropriations Chairman Stan Saylor, who has fought for the folks behind me and our long-term care workforce throughout the state, especially throughout the COVID-19 pandemic. When we ask who will care, I immediately think of Chairman Saylor, because I know he does. Mr. Chairman, thank you.
Thank you. I'm honored to be here today, and I want to thank all the workers behind me for their dedication through the last several years. You heard earlier from Zach about the challenges that our long-term care providers are facing across our state. The last 2 years, as you all know, has been very challenging, but none more than for our nursing homes. Throughout this time, we've stayed in constant contact with Zach and Tim Ward to understand what their industry really needs to survive and how can we work to deliver exactly what they need. In 2020, we allocated over $630 million in care funds to go directly to support long-term living programs, the single largest allocation in Care Funds Act. Last year, we set aside nearly $300 million to help nursing homes assist in living and personal care homes related to PPE staffing and testing and other related COVID-19 issues. As we work through the finalizing this budget that's coming up this year in 2022 fiscal year, House Republicans will once again put our nursing homes and personal care homes and their residents and our workers at the top of our priority list. You know, many times when we think about nursing homes, we don't think about it until mom or dad or grandmother or even one of our own children may need one because maybe some auto accidents. That's not the time to think about it. We in Pennsylvania have a choice to decide whether we're going to take care of people who took care of us throughout our lifetime, are going to get quality care, or are we going to stuff them into some storage shed somewhere? Because that's where we're headed if we don't set this as a priority. And I'll tell you, these workers behind me today did the very best job they could for our seniors, and we have to make sure that they're getting paid the proper amount of wages. We have to make sure that there are more people who are willing to dedicate their lives to helping the people in need. Again, I want to thank all of you behind me. Thank you for your dedication and your love for the people you serve. Thank you.
Thank you, Mr. Chairman. I now want to welcome another PHCA legislative champion, and I also first want to recognize Representative Wendy Thomas for being here today. Thank you very much, Representative. I want to bring up Senate Aging Committee Chairwoman Judy Ward. Senator Ward's background is in nursing, and who better to understand what these advocates and our workers have been through over the last 2 years. Senator Ward has been a champion for PHCA. She has been a champion for long-term care, and we are very, very proud to be joined by her today. Senator Ward.
Good afternoon, everyone, and I'm going to start off with an apology. I have a voting meeting here in a few minutes, so I'm going to have to scoot out afterwards, but what an absolute honor and privilege to be here to spotlight this very important issue. And I first, like Chairman Saylor, want to take a moment to also thank the countless caregivers and nurses across the state who work long hours trying to keep our loved ones safe, comfortable, and healthy. My mother is currently in a long-term care facility. She will turn 100 years young in November, and I have seen firsthand the hardships that nurses and staff are going through at this very difficult time. Our loved ones in need of nursing care should not be in a situation where they cannot access that care. Throughout the state, nursing homes are turning away someone's parent, grandparent, aunt, or uncle because there aren't enough workers to care for more people. The COVID-19 pandemic not only placed a spotlight on the critical role long-term care has in our state's healthcare continuum, but it also highlighted that we must be doing more to support residents and healthcare heroes in our long-term care. It is estimated that 52% of elderly individuals will need some type of long-term care services in their lifetime. That means more than 1.18 million people will need long-term care over the next 20 to 30 years. If we don't begin to invest now, Pennsylvania will not be equipped to serve the aging population in our state. My colleagues in the Senate and House, along with Governor Wolf, have a real opportunity for transformative action that will invest in our vulnerable population and help sustain essential care in this year ahead. With this budget, providers in the industry are asking for an increase in state funding to raise the Medicaid reimbursement rate for nursing homes. This sustainable investment will empower nursing home providers in my district and throughout the Commonwealth to address the new realities of providing care, including higher wages for frontline caregivers, workforce recruitment efforts, and infrastructure and operational costs, as well as food, utilities, technology, and facility upgrades. I'm happy to support this much-needed increase. Since the start of the COVID-19 pandemic, Pennsylvania has had a net loss of 11 nursing homes. In recent weeks, our state lost a specialized post-acute respiratory care facility that was forced to close because of rising costs and Medicaid underfunding. And another nursing home announced it will be closing in 3 weeks for similar reasons. I have introduced Senate Resolution 288 that directs the Joint State Government Commission to study the rising cost of long-term care facility personnel, the expertise and experience needed to work in those facilities, the current workforce environment for those employed, and the level of care required by residents. Just this morning, Aging and Youth Committee voted my resolution out of committee, and it will now go to the full Senate for consideration. Our long-term care facilities need help. My hope is that our legislation is a step in that direction. As a registered nurse, I have a strong passion and commitment to ensure long-term care facilities receive necessary funding to guarantee all patients the proper care. I understand the hardships that staff go through every day to care for their patients. I will continue to work with my colleagues in the Senate and House on legislation to provide this much-needed relief to this very critical industry. Thank you for the opportunity to speak today on this very important issue, and I thank you all behind me for what you do each and every day. Thank you.
Thank you, Senator, and thank you for your support. We have a change in the program because I want to welcome the Aging Committee Chairman in the House, State Representative Gary Day, to say a few words about long-term care and his support for long-term care in Pennsylvania. Thank you, Mr. Chairman.
Thank you. Thank you all very much. I'm so excited to be here. I brought my comments with me here, and I'll lay them out here. You know, when you live in this space like these people do, like Zach Schamberg does, you don't need the comments or the speeches. It's important to stay on message. And what is the message today? The important thing is they made me the chairman of the Aging Committee right before COVID-19 hit. And it ripped through our communities, our long-term care communities, and it ripped through Pennsylvania. And it was something we didn't know exactly how to deal with. But these workers went back in to these facilities. And when you say, can I borrow this? Who will care? It was all of these people here. It was the administrators, the frontline workers, the administrators, and the nursing home owners and managers of these facilities. Who will care? These people will care. Thank you very much. And I just want to say, now is the season in Harrisburg, the budget season. We speak through what we put money towards. The line items that we fund are what we deem are our priorities. It is time for Pennsylvania, in the Pennsylvania House of Representatives, the Pennsylvania Senate, and the governor, to continue to do the work that we've done and allocate dollars toward our nursing homes. We're here today, we have speakers today to talk about possibly shutting down our nursing homes. Just where will these Pennsylvanians go? Will they be able to go home? Will there be other people to take care of them? That's what the question mark is on these cards. We don't know. I'll say maybe not. Pennsylvania must move forward and make our priorities with where we put dollars in this year's 2022 budget must go toward our nursing homes. Ladies and gentlemen, I'm State Representative Gary Day. I'm chairman of the Aging and Older Adult Services Committee, and it is high time we make priorities of the people who got us here and took care of us. Now it's our time to take care of them, and we do that in our long-term care facilities. And I urge all of my colleagues and all of my leaders in the House and the Senate and in the governor's office to allocate appropriate funding for workforce wages, workforce recruitment, and infrastructure investment. Thank you all very much. Thanks, Zach.
Thank you, Mr. Chairman. I want to now bring up Jim Brogna, who is the Vice President of Strategic Partnership Development at Allied Services, a new PHCA member, and one of the strongest advocates I know for our industry, to say a few words. Jim.
Thank you. Thank you very much. Thank you. I'm not an administrator. I'm not a frontline worker. I'm not one of the heroes that are standing behind us. Our team can't leave the facility, and I'm here representing our team. My name is Jim Brogna. I'm Vice President for Strategic Partnership Development with Allied Services, and I'm proud to also be a member of the PHCA Legislative Advisory Committee. My personal story is the fact that my stepmother passed away in June of 2020 during the pandemic in a facility in Florida that had adequate funding and outstanding care. My dad was separated from her for that period of time, but he entrusted the care in those individuals, much the same way our colleagues here provide every single day. Our loss was devastating, but we at least know that she was cared for appropriately and the funding was there to support her needs. I'm honored to stand in place of and in memory of my stepmother and all these individuals and the 3,500 individuals at Allied Services Integrated Health System who provide post-acute care, who provide world-class rehabilitation, home care, human services, hospice, but for today's purpose, personal and skilled nursing long-term care. When you hear the question, who will care? I want you to remember that providers like the one I work for, Allied Services, and all these workers behind me across the state are delivering that care day in and day out. Our ability to ensure that care is being compromised and our mission of caring for others is in jeopardy. We shouldn't have to be here today questioning our viability. We should be back in our communities supporting our colleagues and the residents that we serve. Many of us did that during National Nursing Home Week. As a skilled nursing facility provider, we can't help but wonder how much of a different situation this sector would be in if the state's Medicaid reimbursements kept pace with the rising costs for care since 2014. Leading into this COVID-19 pandemic, the average statewide operating margin was in the red. Why? Because we care. We care predominantly for those who can't afford the care on their own and rely on the state to cover their costs. If we turn those residents away, where will they go? In our own long-term care facilities, Allied has nearly 80% of its skilled long-term care residents on medical assistance and Medicaid. How could we sustain this? You only have to look back a few months to find the answer of the challenges. Hospitals were overwhelmed during another COVID surge in January, with no ability to discharge patients to nursing homes because our nursing homes didn't have enough staffing to cover accepting new residents. Other seniors continue to wait at home and struggle with activities of daily living after being put on a waiting list to be admitted to nursing homes. If the care of those relying on Medicaid is adequately funded, providers could invest more in our workforce development with competitive wages. We could be more aggressive with worker recruitment. We would be able to afford the rising costs and inflation to maintain daily services and costs without the fear of having to close the doors for good this year. Our ask of our General Assembly and Governor Tom Wolf is to do what's right for the citizens of Pennsylvania. Fund an additional $35 per Medicaid resident per day in support of our state's rapidly aging and very vulnerable population. We should be prepared to manage the needs of those we love, but instead, long-term care providers are being forced to turn those loved ones away because we can't afford to increase our workforce or the cost of daily operations. In fact, early in the pandemic, Allied Services Skilled Nursing Center closed the only long-term care ventilator beds in northeastern Pennsylvania because we couldn't afford to sustain the workforce and we couldn't afford the challenges that were associated with that care. My colleagues, as well with other providers across the state, will continue to care as long as we can. But when we can't provide that care anymore, we ask, who will care? We need the state to care. We need our leaders to care, and we need them to stand with us right now. Thank you.
And finally, I want to bring up Jen Drescher, who is the chair of our Assisted Living and Personal Care Board of Directors from Arden Courts, to share a different perspective and the assisted living and personal care perspective of the last 2 years and what is needed this year. Jen.
Thanks. Thank you, Zach. Good afternoon. As Zach mentioned, my name is Jennifer Drescher, and I'm the Regional Director of Operations for ProMedica Senior Care. We serve the Arden Courts communities, which specialize in memory care and our most vulnerable population. For those unfamiliar with ProMedica, we're a nationwide nonprofit organization providing care in 26 states and the largest nonprofit long-term care provider in Pennsylvania. With a commitment to quality, we serve in many capacities to care for seniors in Pennsylvania and around the country. But expanding the mission of care has grown more difficult. Memory care has not been immune to the workforce crisis. No group in long-term care has. Those who once had a passion for serving others in assisted living and personal care have been easily lured away by higher-paying jobs at hospitals or in other industries. Some might say, well, then just pay your workers more. But unfortunately, that's easier said than done. We've all noticed inflation has forced cost in a rise of our own lives. Now imagine how much these costs have gone up for a community that operates around the clock, 24/7, 365. But it's not just competing costs that limit a provider's ability to increase wages. It's that additional revenue to cover any cost, the higher wages included, means increasing rates to our customers. Or in the case of long-term care, it's increasing rates on our elderly population who are already living on a fixed income. I'm here today as a voice for the residents I serve and all of the healthcare heroes that I work alongside. More must be done to support our older population. That is only continuing to expand as the baby boomer generation ages into a demographic that is also in need of care. When I say more must be done, this isn't a blanket statement. There are things that can be addressed immediately to support the care we provide, and here are just a few. The hospitals received hundreds of millions of dollars in American Rescue Plan funds to support their workers in January. We are asking the legislature and the governor to allocate ARP funds to the frontline caregivers in assisted living and personal care so that we can reward and retain our workers with bonuses and work to recruit more staff. We are asking that the legislature and governor support House Bill 2293. This legislation would provide more oversight on staffing agencies, a staffing resource that has opportunistically taken advantage of providers and ultimately residents during the pandemic. More oversight will help end their harmful tactics. And we are asking that Pennsylvania leaders consider Medicaid reimbursements for assisted living communities. Our residents shouldn't have to transfer to a long-term care facility nursing home because they don't have the necessary funds to remain in an assisted living community. If assisted living communities are able to receive Medicaid reimbursements for resident care, Pennsylvania taxpayers would save money and nursing facilities could see an ease on the overwhelming amount of admission referrals they are receiving. Pennsylvania's population is only growing older. We can no longer neglect the importance of long-term care. I'm here because I care. Everyone behind me is here because they care, and I hope others will care too. Thank you.
So we've asked the question, who will care? And that is the question for the next few weeks. We stand ready to work with members of the legislature and the Wolf administration to get this done this year for our healthcare heroes and the residents they serve. Thank you very much.